and welcome to Uptime, the podcast from .med Healthcare Business News, where we dive into the issues shaping the medical equipment industry. I'm your host, Keri Stevens. HCB News is free to read, so if you're not already signed up, head over to .med.com/news after the podcast to register. Today, I'm thrilled to be joined by Dr. Francisco Rodriguez Campos, Principal Project Officer in the Device Safety Group at ECRI Institute, for a timely discussion on AI, chatbots, which recently topped ECRI's 2026 list of health technology hazards. We'll explore what this means for healthcare organizations, clinicians, and patients, and why staying informed has never been more critical. So let's get started. Francisco, thank you for joining me today.
Hi, Keri. Thank you for having me. So this is an interesting topic.
Very interesting. Well, I'm just going to dive in. So AI chatbots were ranked as the #1 health technology hazard for 2026. So from your perspective, what's driving that concern and why is this issue rising to the top right now?
I think, probably you are aware, chatbot has become so popular. Everybody is talking about using ChatGPT, Claude, Grok, Copilot, whichever you like to use. So, and, in addition to being used a lot at healthcare institutions, it's going mainstream. So that's just creating other issues. And, you can have it in your phone. You can have it at all times with you. So it is very tempting. It is the new web search, it's very tempting just to go there and it will give you a summarized answer. I am sure, like everybody else, very often you go and try to search for some symptoms that you think you may have. So, and these chatbots are giving let's say a longer answer, an answer that people tend to understand better sometimes.
Yeah, and millions of people are turning to AI tools, for health information every day. So what are the biggest risks when patients use chatbots as a substitute for professional medical advice?
Well, I think that's the key point. It's not a professional medical advice. And a lot of people are using this like, oh, yeah, it's written in stone. That answer is the greatest answer ever, so I am going to do it. There have been cases where the large language model just responds with a treatment, and people say, okay, before I go to the doctor, or, they may have an appointment that is 6-7 months down the road. So I say, oh, let me try this. And, the outcomes haven't been great.
And then there's the issue of bias that I know that's an issue where people are, having biased results. Certain things might work for certain populations. Can you talk about the bias part?
Well, yeah, I think the models have improved a little bit in those terms, but, they are training the information that we have. And I think, unfortunately, a lot of that information is biased by itself. There have been some tools that were out there and were put to be used by medical professionals, but they still had the bias. And I always go back to it was the famous equation that just consider certain population for diabetes, and it was a factor that pretty much was made up at some point in time. And that was never changed because they didn't have the data. Now we do have the data and it has been updated. So, there are a lot of things like that where these models were trained on, data that has very marked biases.
So what made ECRI list this as the top technology hazard for 2026? What was it specifically about that?
So I think that it was this concern. We start to notice that a lot of people are using it. And don't get me wrong, they are great. Like, I think a lot of patients are going like a little more informed when they, are going to a specialist and have an issue. The problem is, like I mentioned before, some of those times that you ask these models, it may provide you with a suggestion of a treatment and they are doing it. And that's, from the patient side. So, and the problem is the answer sounds convincing. Now, in the other side of this, in the clinician side, there were reports, that they were asking these models for treatment plans, for example. So, they sound good. And I think that's a great benefit that will be good later on when the models are really, refined. The answer is nice, it's very understandable, it makes sense, but they notice at the start to make up things. Hallucinations is not a uncommon thing in these models. They find out that there were even references to journal publications that did not exist. But it sounds so good and great. They were written so nicely. It's like, oh, wow, this is a nice paper. Let me look it up. Well, it wasn't there.
Yeah. And there's a lot of conversation about AI as a tool to support clinicians. So, where do you see the line between assistance and over reliance? And why is that distinction so important?
Well, I think, the bottom line to that is who is liable. Clinicians are liable for their decisions, and these tools are a great support system. Don't get me wrong, like all these repetitive tasks, they can help with that. And one example is the ambient scribes, for example, where there are great results. When you go to your doctor, instead of having to type, being clicking things on the computer and really not paying attention to you, or they are trying, but they have to be typing, they are having a conversation. And that's great for the patient, because you feel like you are really being here. They are really paying attention to your symptoms. So, it's a good result. But the more I speak with physicians, they say, the ambient scripts are great, but I like my notes better. And then there are some other things like human factors, where the window appears covering something that I actually need to click. So I think there are mixed reviews still, but they do understand that, this is a support thing. And while they will suggest you something, they always have to revise. That's what we say. A human always has to be in the loop.
I mean, you hear that though, that, okay, are these bots going to replace doctors? I would love to hear your response to that.
I don't think we are there, and I don't know when we will get there. And well, you as a patient, would you like to be there?
So no,
you know.
no, no.
Well, so I think for certain things, and and I think there are some pilots going on. I don't know if you saw there is a company or there is a health system in Utah that is testing prescription through a chatbot.
Okay.
So, it seems to work well because that's an issue. You need to refill a prescription, and now you have to call, I guess you call the pharmacy will call the doctor.
Right.
And it's in between them. You are out the loop. And when you call the doctor, say, call your pharmacy, and they will call something like that, depending on your state. So they're trying that. It's promising. I think eventually some of those tasks will replace a doctor. I'm not sure about that.
We hope not.
Yeah.
I don't think it'll ever happen, but I definitely think there's talk, there's fear. And I think fear is the biggest thing where it's like, what do you do with this AI? Because in some ways it's amazing, but in other ways you see the downfall. And like ECRI talked about, there's a lot of downfall that can come from AI.
Yeah, and unfortunately, I think we are in a point in time where there is staff shortages.
Right.
So you will think, well, maybe AI could help with some of that. But yeah, like you say, it's kind of scary that we'll think we will replace a doctor or a licensed clinician doing something like this.
Right. Well, we touched on this earlier, but can you talk more about the biases embedded in AI data, training data? So how could that potentially reinforce or even worsen existing health disparities?
So, there is, like I say, they are using all the data is available. So the as good as your data is, that how the training of the model will be and the answers that will provide you. It's not the same. And we have seen examples of that. For example, there are some applications that will look at moles in your skins, and if your skin is like mine a little darker, the result is not the same that is looking at the picture of your skin, just because, and the bias there is probably there were more pictures with a specific tone of the skin than others. And those are there, and that's what is available. So you thinking the same thing when you move to these like chatbots and large language models. They are training on the whole internet, and they are, let's say, the production, the output is a product of a probability or linguistic combination of words, but it's based on what they read. And I don't know if you remember when these models came out at the beginning, some of them were racist, and that's because of that information exists and they were trained on that.
Right.
And so all those things needs to be corrected. The same thing is for healthcare applications. Um, it's more likely that there will be more data or more written reports about a certain ethnic or racial group than others. And we can go back, and there's a lot of cultural things. Some ethnicities don't like to go to the doctor as often, or then you add on top of all that socioeconomical issues. Some people cannot afford to go to the doctor that often, and so you have all
Which
these
covering
disparities.
all that for
Yeah.
sure.
And
We've talked about in the past, racial bias in medical devices where the pulse oximeters were not working on people with darker skin tones. They're not giving it accurate reading. So, I mean, I think that is such a broader topic and one I would definitely like to explore more because it's a huge deal. And
yeah, and you can imagine that wasn't like, what is the source of that was not tested in darker skins. You go to other regions of the world and they do use these pulse oximeters where those adjusted over there, and that information was never translated. Companies, the same companies are designing this. Same thing for these models. You can go to other regions of the world and they have their own models. So the information from them is not translated to these other ones. That's part of the questions that we need to have. How you model will train will really fit with my population, because the population is not the same if you are in, I want to say, like northern Maine, Montana, that if you go down south to Louisiana, the population is more diverse, and the data that or the model fit into your population is slightly different.
makes sense. Okay. So, for healthcare leaders listening, and that's definitely the majority of our audience, what practical steps should organizations be taking now to ensure responsible oversight and safe integration of AI tools?
So I think it comes down to governance, and that has a lot of several steps. And I think some of the important ones is you need to look at what really you are going to replace with AI. I know it's very tempting to say, oh, we have AI, and as a marketing tool, and it's a valid point, but you have to really look at what process are you trying to improve with AI. Then the next piece of that is education. You need to educate everybody, and this goes from the leaders telling, like, AI really can do A, B, and C, but it's not magical. It will not do the whole alphabet for you. And just be very clear about that. And that has to go down to all your different units, nursing, your physicians, all the way to your patient. Because, when you get to the patient, you have to tell the patient, hey, listen, we are going to use AI for this. Are you okay with it? Has to be a consent and all that. So I think it's a whole governance / education effort. And everybody has to be aware of what AI can do and what AI will do for them, and what you shouldn't be relying on.
So, if you had a crystal ball, and I know you don't, but where do
No.
you think the AI is headed for the medical and for medical?
I do think it will start to, AI has been in the medical field for a while. Like in medical imaging, it's a different use. It's not a user from
Right.
implementation, but they have been there. So I think it will be improving more of stuff like that is working in the background. I think we are getting to the point that more AI, like user facing, will start to appear. And, we are seeing it in a lot of different cases. Like there are some chatbots where you can go as a patient and try to see if you can schedule your appointments. I am sure everybody is aware, like, big hospitals, when you are going to a procedure, they have a dedicated web page that will explain you the procedure. So that information probably will be translated to a chatbot that will maybe have a better way to interact with the patient and explain the procedure. So I can see more of that. Now in the hospital side, I do see ECRI is becoming better, to help with medical notes. And there is a lot of administrative processes too that can be improved. I have seen a lot of efforts in terms of We will have an AI in the hospital that will talk to the AI in the insurance just to assure reimbursement, and avoid all this back and forth with letters.
So futuristic.
Yeah, I just saw an interesting example the other day when he said, yeah, our AI will write the letter for their AIs. So I was like, well, I guess at some point in time, we may not even need the letter. Why?
It's wild to think about. So, a second to last question. I just want you talk more about the ECRI report and just what you think our audience needs to know about AI chatbots being the top health technology hazard for 2026.
So yeah, I think what like one of the things that we are saying is like, you need to be very aware how you limit your chatbot. Those are part of the big recommendations, and we know they are coming. There is no escaping from them. So if you are implementing one of those, just be very aware of, like I said, what process are you going to improve, and make sure you have your limits well defined. And what I say is, a lot of institutions are implementing, okay, I take a large language model that have been trained in how to produce good responses. But now what I am going to do is I am going to give all my information that is in my intranet. So because I want this chatbot to answer my patients. Now, these are limited. These are limited to the information on the internet, and they only can go and pull information from there to answer. So that's, it's a good use. The next stage is when they are going to let you access some information on your health record to even customize the answer even better. In that point, I think hospitals need to be very aware what are the privacy procedures in place. Because, all this can be implemented, but it has to be implemented in the right way. So you need to be very aware of how are they managing their, privacy settings for their patients. And of course, you can think in terms of there has to be also cybersecurity involved, because even though it's just looking at the local information, the model has to go to the cloud for the basic training of how to produce the answer, even though there is no information being sent to the cloud.
That's great. So, my last question that I ask every guest is what is keeping you up at night? So, from the whole health technology sphere, what is keeping you up at night right now?
I think that will be you see a lot of implementations out there that are kind of going under the radar, because they don't need to be FDA cleared, for example. They are not giving a diagnosis, but they are doing have a big influences of those diagnoses are being delivered. I think in the general public, what keeps me at night is anybody can just go and say, okay, I have X, A, B, and C. What should I do? And there is a big percentage of population, or well, no, I should say a big. There is a percentage of the population that will take that and do it, and I think that's scary, because you have seen people spending weeks in the hospital for trying one of those treatments. Unfortunately, you have seen other people taking their lives because, they went into this old rabbit hole when they think the chatbot is actually somebody really interacting with them. So I think that's what keeps me at night. There are some safeguards that are not in place yet.
Hopefully one day, I guess. But well, Francisco, it was so wonderful to have you on the podcast. And to our listeners, thanks as always. And be sure to look out for the next episode of Uptime. Take care.
Thank you for having me.
Thank
Bye.
you.